So first of all, not everybody might know what El Niño is. So El Niño is a pretty complex climate pattern, and in southern Africa, it brings high temperatures and below average rainfall. So this significantly affects agriculture and leads to water scarcity, food shortages, and disease outbreaks. So you see it's a predicted phenomenon, but the way it pans out exactly is not easy to predict because, yeah, the El Niño phases are really known to be irregular and happen every 2 to 7 years and last between 9 months and 2 years. I do also want to explain a little bit why we decided to have this focus on HIV and SRHR in the El Niño responses. So you should know that any kind of emergency, let it be conflict or climate-induced, increases HIV transmission. There's a couple of key drivers that lead to this, which ranges from social disruption to breakdown of community support. Of course, there's increased levels of gender-based violence, and if it's sexual assault, trafficking, or early in child marriage, all of these can have an effect on HIV transmission. Economic instability, food insecurity, and limited supplies, like, for example, condoms, which are clearly linked to HIV transmission, also are affected by different elements that El Niño brings, as I explained before, like water scarcity, etc. So all of this, together with the disrupted access to HIV services like ART, so like regular medication to take as treatment, or HIV testing, all of these services are disrupted, which of course then has an additional effect on HIV transmission rates. And one thing that came out clearly out of the study and that I want to put in the forefront right from the beginning is that any vulnerable population, let it be adolescent girls, key populations like sex workers, men who have sex with men, the LGBT community, people who inject drugs, any of the vulnerable populations will be even more marginalized and face heightened stigma and discrimination and barriers to care, including HIV care, which leads to emerging coping strategies like transactional sex, for example, which then again elevate the risk to HIV transmission. And this, while it's true to most emergency situations, has come out very clearly in the study as well.